I've struggled with this my whole life. It just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
So Dr. Lebowitz, Long Island Gynecomastia Center, Long Island VaserLipo Center. This young man, he's from the South, and he comes up. I did him, oh my goodness, a year and a half ago? Basically a year and a half ago. Yeah. And my old technique, we did smart lipo and the incision right over here. If you come on in here, that's the old incision. I don't use those anymore. I now transfer this incision through here. And now instead of smart lipo, which is a light energy based lipo, I do Vaser lipo, which is a ultrasound energy based lipo. Stealth incisions here. And now I've got curved cannulas and powered cannulas. It's a whole different operation I do. He's got a pretty good result. Here is his pre-ops from a year and a half ago. And here are his post-ops. He's been really whittled down here, but I want better. He wants better. He called me up a couple weeks ago, last month, or whatever he did, 2 months ago. He says, Doc, can you hit me again? I go, no problem. So we're going to now, with my stealth incision here, and I'll make a little incision here where the glands was. He has no glands there. Glands are gone, but he's got some fullness there, but I don't have to go in there and get the glands out. I can Vaser it. And I want to also include now my six-pack. My upper six-pack. And obviously on both sides. And we're going to stealth incision, and we're going to contour him and sculpt him to absolute perfection. So without much more ado, we will mark him. Okay. So here we're gonna do this. The lat's back there. The lat's back there. Now, let's see where his rib is here. So his first. Now make a little, bend over backwards. There you go, and crunch. So you got one, the first one about here. Semilunar line about here. Crunch in there, baby. Good. Good.
I don't have to write a note.
Don't go above that because I want to fullness there. I'll give you a deltopectoral groove. So we get that deltoid muscles there.
No, don't let us talk.
Come around to this line here. I think that's pretty good. Okay, so here we go. Right in the little area that's numb. And let's pump you up. Hans and Franz. So this is a redo. It's got some scar tissue from the Smart Lipo. Smart Lipo gives you a lot of scar tissue. That's why we switched over to Vaser. It's a whole different and better operation. Deltopectoral groove. Deltopectoral groove. Get that six-pack, first inscription there. Better definition, better technology, no more incision over here somewhere. Now it's hidden. Scoop down as low as I can go. Include the top of the belly now. So gynecomastia with Lebo here. Dr. Lebo is not all about this, it's about this and this and this and this and this.
deltopectoral
groove. So this is the semilunar line. And I'm going to empty the space to the semilunar line and laterally. Really nice. I can get into these little areas and make curves. See this curve? Give you that top. Dr. Lebowitz, Long Island Gynecomastia Center, Long Island VaserLipo Center. Redo, touch up on this young man. He looks actually great. Please note the deltopectoral groove. Make a muscle. See that deltopectoral groove? Come on over here, Garrison. Come around here. See that deltopectoral groove over there. Also, do a little crunch. Do a little crunch. See the upper six-pack here, here, and here. The linea alba here, and the semilunar lines here. He's still swollen. He's got over 3 liters of fluid that I used to numb him because it was scar tissue from the original operation that we had to break up. But he's gonna look amazing. Stealth incisions, not here anymore, in the armpit right there. And of course I explored underneath the nipple to make sure that everything's perfect. So make a muscle so you can see kind of how tight he is and how he's gonna look amazing. So if you have gynecomastia, call me, Dr. Lebowitz, Long Island, New York, 631-424-0101. And remember, I go over and above. I go to the lats, to the upper abdomens, to the shoulders, to the deltoid muscle here, all over. It's not just about the nipple, it's about the whole area. 631-424-0101. Thank you and see you soon.